This will not, as they say, I will not be before you long. So, what we're going to have today is a discussion, conversation, presentation regarding blood pressure medication and your laboratory results. Okay, so I am Dr. Fryson, and of course, those of you who know me know that I am a natural health doctor. I am also a clinical laboratory scientist, a shaman, holistic health practitioner, a Reiki master, a lot of different titles. But the biggest thing that I am is an educator. I like to inform the masses about the information that could be helpful to them in their health. I am a patient advocate, and I'm presenting to you today on behalf of Dr. Fryson Institute of Health and Spiritual Education. Again, that's drfryson.com. But it is sponsored by my business, Fryson Intuitive Group LLC, which is www.fighealing.com, and tsfcenter.com. tsfcenter.com is where most of my products are listed. Okay? Welcome to anyone who joins. Now, if I am not able to say welcome, that's because I'm looking at the monitor over here. But I will get back, and if I see any comments, I will try to address them. This video presentation is being recorded. Okay, so the agenda today is to discuss why blood pressure matters, the common blood pressure medication, review blood pressure medication's effect on laboratory values, review herbal remedies and their impact on blood pressure medication, and provide tips on staying on track with your blood pressure medication. So I want to start by making sure you are aware that blood pressure medication is prescribed often without the patient understanding why they are on the medication. Some patients are told their blood pressure is high, here's a pill, but they don't understand what that means, what high blood pressure is, whether or not they have to stay on blood pressure medication for the rest of their life. They don't understand what this can do to their body, to how it can impact any other diseases that they have going on. So these patients often lack general education. And as part of our patient advocacy efforts, Dr. Fryson Institute for Health and Spiritual Education presents information on various topics in order to inform God's people. Yes, God's people, right? So again, this is the Dr. Fryson Spiritual Wellness Center. It's the parent nonprofit company for my education center. So let's start with one of the most important things is why blood pressure management matters to you. One, I want to start with saying that a lot of people are not aware that once they are placed on blood pressure medication, they are generally placed on that medication for life. That is the solution, the answer. So many people who go on blood pressure medication will need to understand how it works and how it's impacting their body for life, for the rest of their lives. Okay? So, in general, the blood pressure is the force of blood pushing against the walls of your arteries. Okay? And when that pressure stays too high for too long, it damages the body. Often with no warning signs or warning signs that are mistaken for other things. Okay? Why does it matter? Well, high blood pressure is known as hypertension. Hypertension affects nearly 1 in 2 adults in the United States, and it can lead to heart attack, stroke, kidney disease, and vision loss. The good news is it is manageable with medications, lifestyle changes, and lab monitoring. Now, your labs are one of the most powerful tools we have to make sure your treatment is working safely and effectively. And another point of making this video is so that you understand that following up on your labs is very vital for your care. Some people get on the medication and they skip appointments for getting their labs drawn, so they don't know if the medication is helping them or harming them They might know their blood pressure is going down, but they don't know anything else that is going on within the body. Okay? So your heart works hard every day, and its blood pressure is really measuring how hard your heart is working. So we're going to start with a lot of information. Don't be overwhelmed. If you are online watching, you can go back to the video and you'll see these drugs written out. Okay? So the first thing we're going to go over is the common blood pressure medication, and we're going to go over them by class. So for those of you who may have joined the Zoom, you can see the presentation, and you see here I have the medication class, the common medications that fall within the class, the typical uses, and how it works. The most prescribed medications for treating high blood pressure fall into several major classes. Current hypertension guidelines recommend choosing based on the patient's age, race, kidney function, diabetes status, heart disease, and other medical conditions, rather than relying on a single medication for everyone. So in my clinic, I have seen that this guideline is not always followed. I work with clients who are on medication that is contraindicated based on their medication history, also based on their diagnosis, their disease state. So I'm going to tell you about the common drugs and what they do. And if you're taking one of these drugs and you know you have an issue, you can go back and have a conversation with your doctor about said issue. So the first thing on the list are diuretics. So diuretics are drugs that cause you to urinate. So by urinating, they reduce your blood pressure because they reduce the fluid in your blood, because urine is blood. It's another form of blood. Topic for another time. So on our list is the big one, hydrochlorothiazide, which a lot of people are taking. That's the number one of the diuretics. And then there's a couple other ones, but on this list, the other one that I see used a lot is the furosemide. And this is a first-line treatment. So most of the time, this is given to older adults and many black patients across the board. That's important, right? And it's important because we know that race plays a role in medical treatment and improvement in medical states. Okay? Now, it flushes out excess salt and water through the urine to lower the blood pressure. If you can imagine, this means that it has an impact on the kidneys, because the kidneys function to bring the urine out. So this medication is actually causing the kidneys to release more urine. Now, overall, in the long term, that could have a negative side effect. That could actually damage the kidneys. I digress. Okay, keep that in mind. So if you get on this medication and then you start having kidney trouble, the medication may be a cause. I want to preface this by saying that I am a member of the American Association of Drugless Practitioners. So we focus on looking at alternatives that don't involve medications, because a lot of the medications have side effects that cause a person to end up on more and more medication instead of correcting the problem, which is what I call root work, which is root cause analysis, getting to the root of the problem. Okay? And the next group of medication is the ACE inhibitor. ACE, ACE, stands for angiotensin converting enzyme. So an enzyme always acts on something. It causes something to occur. So it normally cuts something down or transfers it in a certain way. Okay, and the ending of the enzyme's name will tell you what it's doing. In this case, this ACE inhibitor means it is going to inhibit ACE, the enzyme. These drugs in this class, they stop ACE. And if you saw my other presentation about the cycle of blood pressure and the angiotensin renin system, then you will understand what ACE is. So the drugs in this category, lisinopril is the number one. Most people who are prescribed an ACE inhibitor are prescribed lisinopril. It is common in patients with diabetes, kidney disease, or heart failure, right? So sometimes a person goes to the doctor and they're put on lisinopril, and they're not a diabetic patient. They don't have kidney disease and they don't have heart failure, when they could have been put on hydrochlorothiazide, which is a diuretic. Okay? Now, ACE inhibitors work by relaxing the blood vessels and blocking a hormone that tightens them, the angiotensin converting enzyme. Okay? So it blocks the hormone and allows the blood vessels to relax and open up and let the blood pressure go down. The next classification of medication are the ARBs. ARB is angiotensin receptor blockers. So it works much like the ACE inhibitors, except for the fact that it works at a different part in the channel, the system, right? So angiotensin 1 is converted to angiotensin 2. This ACE acts on it in one place, the ARBs act on it in a second place, but they do the same thing. So losartan is the top one in that category. Now, the problem with this one is one of the side effects is that it causes a cough. So some people who are taking this medication, they're like, oh, I have this cough, I can't get rid of this cough. Well, that's a side effect. And then what happens, what I see happen with my clients, is they're looking for something to help them not cough as much when the medication that they're on causes the coughing. Okay? So in order to stop the coughing, they have to stop the medication. All right. Our next group are the beta blockers. Beta blockers, this is metoprolol, and now this is normally reserved for patients with coronary artery disease, heart failure, or certain arrhythmias. This is also given to patients who have a genetic heart disease, right? So it slows the heart rate and reduces the force of each beat, slows the heart rate. You can imagine that could be dangerous, especially if someone is on the wrong dose. If someone is taking too many, they miss their medication and they try to make up for it by doubling up on the medication. This could be dangerous. The important thing here is that a person who has coronary artery disease probably needs this if they have not undergone surgery, or if they don't plan on undergoing surgery. Depending on the age of the person, the doctor may think surgery is counterindicated, right? Counterindicated meaning that surgery would cause more harm than good. So they say, hey, although this is normal for most people, we're going to say not normal or not do this in your case. And normally that's an age or another disease issue. So if someone has for instance, I was diagnosed with lupus in 2017 and I needed a surgery, but I had a series of blood clots. I had a DVT, and they said it's more dangerous to do surgery on you when your body is over clotting, right? My body was sending clots, sending clots, sending clots. So it was too dangerous to do the surgery. It was better to not correct the issue and fix the clotting, right? So that's the case with some of the medications, like beta blockers are used instead of heart surgery for some people. And sometimes it's used after heart surgery for a person who has chronic coronary artery disease. Chronic means long term. Okay. Next medications in the final medication class are the calcium channel blocker. This is important. As the name states, it blocks calcium. which is, most people know calcium's in your joints and calcium's in your bones. People know about calcium that way. They don't know that calcium plays a role in many of the chemical functions in the body, including the functions related to heart health. But calcium can be built up in the blood because calcium is deposited in the blood when you have fibrins, right, from fibrinolysis, or the breakdown of fibrin particles. Sometimes they're pieces of fibrin that are built up in the arteries over time. This, of course, is related mainly to diet. It could be genetic in nature, but is mainly diet related. So the buildup of the calcium causes the plaque, and the plaque that is formed makes it difficult for the blood to flow through. So what they have are calcium channel blockers, and on that list, amlodipine, and this is used frequently as a first-line therapy. They consider it to be effective in older adults and black patients, and what it does is relaxes and widens blood vessels by reducing the calcium in the artery walls, which is the same thing that they do essentially sometimes during surgery. They remove calcium. They normally do a bypass. They take a new artery and send it to the heart to where the blood flow is much better. That's another story. But yes, I used to work in OR, and I've seen this firsthand. So the reality is that removing the calcium, reducing the calcium, causes the blood pressure to be lowered. But this is frequently used as a first-line therapy, but not always used as a first-line therapy. I have people come to me and they're not on calcium channel blockers, and they're obese, they have clotting issues, they have, all these other histories, and it's like, why did they put you on a diuretic? This is, in my opinion, not the correct way to go, right? I have had clients come to me and they're on 3 different medications in 3 different classes, right? Which is a problem as well. Okay, so the most prescribed individual blood pressure medications include lisinopril, top one, that's our ACE inhibitor, amlodipine, losartan, then hydrochlorothiazide, and metoprolol. Now, blood pressure medications are effective, but they can shift certain values in your lab work. This is why regular monitoring of your labs become important. So we're now going to get into laboratory monitoring. Okay? There are key lab values that your doctor will monitor when you start blood pressure medication. And I want you to know what they are and what it means, why they are being monitored. This is why it is important for you to follow up with all of your appointments, get all of your lab work done on time. So, first lab value is potassium. This is the most important one. I say most important when in terms of blood pressure medication, but all of them are important. So once you start taking these medications and your doctor starts monitoring them, your doctor wants to know if the potassium is too high or too low, because either one of those can affect your heart rhythm, right? Whether or not your heart is beating, okay? Beating too fast, beating too slow, both of those have negative outcomes. The next lab value is sodium, abbreviated Na. Potassium is abbreviated K. So if you see me use K on the slide, you know what that is. Low sodium, low salt. Sodium is your salt. Low sodium can cause fatigue, confusion, and dizziness. So we see this sometimes in the elderly population. People say, oh, my mom, she was dizzy and she fell. She's been having these falling spells. It could be tied to one of the medications that your mother is taking. This is why it's important to know what their labs are. And if you are your family's patient advocate, I recommend that you gain access to their chart and that you have a form filled out uh, to where you can have the doctors can talk to you about what's going on with the family member. So if you don't fill out this POA, if they don't have this on documented, if you don't fill out a health surrogate form, if you don't have all of that, doctors may not give you everything that you need to know. And you may not see these results because I have to tell you, a doctor who is seeing hundreds of patients in a day is glancing over your information. They aren't 100% locked in. Some are, very few are, but some are. But the majority of them, they're hitting the highlights, right? And they're not looking at the trends on your patient, your mother, your father, right? So you as a patient advocate must do this. Now, the other thing that's measured is creatinine. Creatinine measures how well your kidneys filter waste, which is why it is one of the indicators of kidney failure. When the creatinine is really high, a person's kidney status, what stage they are at, can be measured. It is not the only thing that measures kidneys. The other thing that's on this list, there's two other things. One is BUN, blood urea nitrogen. This is a kidney health marker, a waste product that rises when your kidneys are stressed. So the BUN, the creatinine, and the EGFR, this is the estimated glomerular filtration rate, which is how you are filtrating this fluid from your body. This estimates the overall kidney function. Lower is more concern. So I'm going to get into what the values are. But if you have a low EGFR and it goes up to a higher number, that actually becomes good. Most of the other numbers on this chart, if they're high, you want them to go low or be in the middle, right? The EGFR is the only thing that you really want to be on the high end, okay? And the last thing that the doctors typically monitor when you're on blood pressure medication is your blood glucose, because some medications can raise it or decrease it, right? And the glucose is the sugar, your blood sugar. Now, this is important because, again, if you're on the medication and you are diabetic, you need to make sure that the blood pressure medication does not interfere with your diabetes medication. Or if you're not a diabetic and all of a sudden your glucose is spiked higher, then you need to check and see if it's related to the medication. Because the other thing that I see is my clients come to me, they had normal labs, but their blood pressure was high. The doctor put them on blood pressure medication instead of doing a diet consult. They were not ever referred to a nutritionist. By the way, I have degrees in nutrition. And they were not told to change their diets. Most doctors, primary care doctors, when they see your blood pressure is high, most of the time the first thing they do is have you change your diet before putting you on a medication. That's if it's at the lower range of high. So right now, normal blood pressure is less than 120/80. Okay, but there's levels to it. There's different stages, 5 stages of hypertension. So depending on where you are in that stage, the doctor might say, hey, change your diet, come back to me in 6 months, or come back to me in 6 weeks, or whatever that time frame is. Or they might say, I'm going to give you a low dose of this medication, come back to me and let's see if that helps. So depending on your physician, what you get. But often, and this is partially on you as the patient, physicians don't take into account the fact that a person's a diabetic or pre-diabetic. And if you don't tell them that you're on medication, they don't know if you haven't given it to them. Doctors don't have access to all of your information from all of your charts. They don't have all of your history because the HIPAA means that everybody can't see everything. So they don't know if you don't let them know. Okay, that's why in the beginning of your appointment, you have a questionnaire where they go through and ask you, have you ever been diagnosed with this, and that, and the other? Some of my clients are like, oh, I didn't want them to know that. That's vital before being prescribed medication, that your doctor know what you're on and what you're not on. Okay? Now, I gave you the labs. Let's talk about what they mean. For those of you who are seeing the slide here, I have what's known as a normal range and a watch out range. So these are your lab values, and I must put this with a caveat that these ranges can change. The normal range is determined by the laboratory that performs your testing. So from city to city, hospital to hospital, state to state, county to county, your values may not be the same. So what is a 3 at one place might be low, and it might be within range at another place. That's also based on the instrumentation that is being used to run the test. But in general, this normal range is what's seen across the United States. So potassium, that's range is 3.5 to 5 milliequivalents per liter. And below 3.5, heart's not pumping as fast. And above 5.5, too much. So below 3.5, you go into a coma and die. Above 3.5, you have a heart attack and die. Below 3.5, you have a heart attack and die. Not enough oxygen gets sent to your brain. You see what I'm saying? So either way, below or above is not good. The sodium, the range of normality is 136 to 145 milliequivalents per liter. Below 130 is bad. Watch out for, because of course low sodium directly impacts your kidneys. It actually impacts the whole cycle. The sodium, potassium, chloride, all are part of a cycle that balances your, those are your electrolytes. So they balance your entire body out with exchanging of energy. And so your sodium values definitely correlate to your potassium and your chloride. So low sodium, I'll talk about what you see presenting themselves, what kind of symptoms show up in your body. And again, this could be bad for your kidneys, which of course is bad for your blood pressure. So it's a cycle. The creatinine normal range historically is 0.6 to 1.2 milligrams per deciliters. Now, the creatinine should vary by sex. I have seen some values that does not have a separate value based on sex, and that is what it is. Creatinine is measured as a baseline, and if it goes up over time, that's bad, right? So if you go into the doctor and your creatinine is 0.8, which is normal, is great. You start this medication, you go back into the doctor, your creatinine is 0.9. They're like, it's still normal, no problem. You go back later, the creatinine is now 1.1. They're like, wait a minute, there's a problem, because creatinine is associated with kidney health. Okay? BUN, the blood urea nitrogen, normal range is 70 to 20 milligrams per deciliter. Greater than 25 or rising with the creatinine rising is sign of kidney damage, kidney distress. Your kidneys are no longer healthy, which of course is bad. Potential to lead to dialysis. The EGFR of greater than 60 is considered good. Below 45 or rapidly declining is bad. Now, if you guys are aware, during the pandemic, there was a lot of information about the EGFR, because the EGFR, before, they had a different range for Black Americans. As a matter of fact, the range was such a disparity that it was causing Black Americans to not be diagnosed with kidney disease and not receive dialysis sooner. Okay, and they changed that and removed the race category from the EGFR so that Black Americans are treated the same as white Americans and other Americans. Now, mind you, this was just done in the 2020, right? So we're talking it not even 10 years ago. It was just removed because the evidence supported the fact that our kidneys are not like superheroes. They can't be worse off, and we do so much better, you know. But that's how they treated us. Okay. Now, as a Black practitioner who has been in healthcare for over 33 years, I've seen a lot of things, a lot of disparities. So this information is vital, and it is why you need a patient advocate, a family patient advocate. And if you don't have one, I provide those services. Okay. The last lab is the blood glucose, which should be fasting. Fasting means you should not have eaten within 8 to 12 hours, and that also means you should not have drank anything like sugar. You could have had your water, your black coffee, your black tea. That's it. If you have anything else that has sugar or sugar substitute in it, you can impact your glucose. Normal range of glucose is 70 to 99. And the general consensus is that if it is consistently above 126, that's the problem. The medical industry does recognize that most people don't really fast appropriately. So if you go in and your glucose is high, like 112, they're like, okay, we can watch it. A lab that is not on here is the A1C. The A1C is also used to monitor the glucose, but it is normally monitoring, not monitoring the glucose specifically, but it is monitoring diabetes. And normally the A1C is performed when a person, like on a regular basis, when a person is known to be a diabetic, or if a person is pre-diabetic, they perform the A1C. But the labs that I'm giving you today are routinely performed. If you were in the hospital, you would have these performed every day because they are indicators of life, indicators of health. Okay. These labs that are here, these 5 labs by themselves, 6 labs by themselves, can basically tell a clinician if their patient's progressing in the right direction or not very fast. Right? It doesn't take long to have these labs run. Okay, so when you get your laboratory results, when you go every 6 months or 6 weeks or however often it is, and you have labs drawn, when you have those labs drawn, you should have access to a portal. That portal is going to allow you to go in and see the lab results. It is going to allow you to see your previous visits, what your doctor said about you as far as added medication. It's going to allow you to see the medications that you're on and the dose of medication that you're on. But it's only going to do that if you actually go into the portal. So after you leave your doctor, I recommend that you actually set up the portal and go in and look around and see what's there. Your labs are going to be there. Your labs are going to be there not as sodium and potassium. They're going to be there as a basic metabolic panel known as a BMP. And that includes sodium, potassium, chloride, bicarbonate, which is the CO2, BUN, creatinine, and glucose. So it's basic metabolic panel. Some of you may have it show up as chemistries. I've seen that on reports where it says chemistries because these things are chemical reactions. They are part of the chemical reactions. So they are the chemistries in your body. Now, the other thing you might see is a category called kidney function. You may not see creatinine by itself. You may see kidney function at the top, and then beneath that you see creatinine, EGFR, urine albumin to creatinine ratio. Sometimes because albumin, if you saw my first video about the angiotensin cycle and everything, albumin plays a part in that whole cycle that helps the kidneys to function and indicate whether or not they are functioning. And then magnesium, especially with chronic diuretic therapy. So if they put you on any of the diuretics, they need to monitor your magnesium. They need to get a baseline and continuously monitor that. Uric acid, which is not blood urea nitrogen. This is monitored because, especially when you have the thiazide diuretics, because it can participate in the gout, which a lot of people, gout occurs in your feet, your toes, and it's excessive protein accumulation in your toes. Well, that's because your kidneys aren't functioning appropriately, and it shows up uric acid, and it can be, you can even see the crystals in urine, which is kind of cool, but not But for me as a laboratorian, it is a little cool. Okay, calcium, they monitor that because thiazides can increase the serum calcium. Okay, and then hemoglobin A1C, I just mentioned, if diabetes or concern for glucose. And the last one is a lipid profile. This is useful for patients who are on long-term therapy or have cardiovascular risk factors. Lipid profile, that's your HDL, your LDL, your triglycerides, that's the fats. Okay? So they're monitoring the fats associated with your heart, which is important because, of course, increased fat buildup makes it more difficult for your blood to flow appropriately, which is normally seen with increased what? Blood pressure, hypertension. Okay. We're going to stop here for a moment, and for those of you who are watching the video, you see me sponsoring a product. For those of you who are not, Fig LLC is my sponsored product. So these are sweet heat capsules, and these sweet heat capsules are my cayenne pepper capsules and orange peel. Cayenne pepper is proven to lower blood pressure. Not dramatically, but it's like it lowers it 10 points or so, and it's a slow effect. But taking cayenne pepper over time is normally considered good for your heart. And the other thing that sponsored this is two things. One, Uroflow tea, which is my kidney tea, which is known to help the kidneys function. And then Sleep Stack, because Sleep Stack has ashwagandha and magnesium glycinate. And magnesium, we know, is good for the heart. And we know that ashwagandha and magnesium reduces stress. And reducing stress helps your blood pressure and your heart to function. And that has been brought to you by Fryson Intuitive Group LLC. You can get these products on my website, tsfcenter.com, because that's where the products are listed. And Fig LLC is mainly where my services for my consulting is listed. Okay? That's the end of that promo. Thank you guys. Also, this presentation is brought to you by my nonprofit. So if you would like to donate to me, you can cash out me at Dr. Fryson, and you have to put in the comments nonprofit so I can allocate the money to nonprofit. If you want to Zelle me, contact me and I will send you my nonprofit Zelle information. Don't use my website Zelle because that is for my for-profit business, right? This is being brought to you by on behalf of my nonprofit. So if you want to donate to the nonprofit, you can do so by contacting me or just cash out me at Dr. Fryson. And thank you for those who have donated to me in the past. I really appreciate it. My nonprofit does not have a lot of funds, but we do what we can. All right, so now we're going to shift over to another thing. We're going to talk about the actual medication and the labs when good efforts go wrong, right? So let's get into this. How do these meds impact your labs? The thiazide diuretics can lower your potassium, sodium, and magnesium, and it can increase your calcium, uric acid, glucose, and triglycerides, the fats. The things you don't want to increase. Glucose you don't want to increase. Now, as one can imagine, lowering your potassium too much, right, can cause you to go into a coma, die. Heart stoppage either way. Heart attack is the same outcome. Lowering your sodium, kidneys not functioning, magnesium, that kind of thing. Increasing your fat, increasing your glucose. Now you become a diabetic, right? Not good. That's why they have to be monitored. ACE inhibitors and ARBs do the same thing. They can increase your potassium and creatinine. Increasing potassium leads to heart attack, right? Increased creatinine, kidney failure. This is especially notable in patients who already have some level of kidney disease. So again, this is a case where the ACE inhibitor would be counterindicated. Okay? Calcium channel blockers, they have very few lab changes, but they can cause peripheral edema. And peripheral edema is swelling, okay? Swelling. So fluid swelling. Normally you see this in your legs, okay? But it's definitely, you can see it in your arms and your extremities more so than anywhere else, okay? Now, the beta blockers, they can mask symptoms of hypoglycemia, which hypoglycemia is too low of a blood sugar, which is also bad. Remember, in life, there's a balance. Too high or too low is bad, okay? And it could affect the lipid and glucose metabolism, how you break down lipids in the fats in your body and glucose in your body. Glucose is used for energy, and this could affect how it is actually able to be utilized, right? So all of that, of course, as one can imagine, is not good. Let's go back. All right, so how does this show up for you in your body? So if you had labs and you're in between going to the doctor, how do you know that the medication is impacting you in a way that's not good? Well, one, muscle weakness. Your legs feel heavy when you start to walk. You have cramps, irregular heartbeat. This can mean that your potassium is off. Your potassium is too high or too low. Sudden dizziness, confusion, fatigue. This could mean low sodium. And with that dizziness, remember, comes the falling. So you got to watch out for those of you who have elderly or people who are new to these medications. Swelling in your legs, ankles, and feet that is new or worsening. As people age and the kidneys start to not function, or they have heart disorder or disease, swelling does occur, but sometimes is maybe a right leg or a left leg or just the ankles, and then it progresses into it's the whole leg or it's both legs, right? So it's changed. Decreased urination, you're not able to pee, or your urine becomes dark in color, because the dark color signifies that the kidneys are not processing it appropriately, or processing the urine appropriately, like filtering appropriately, okay? Then, next thing is persistent dry cough. Again, that's attributed to the ACE inhibitors. And then your blood pressure readings that are unusually high, and they say above 180 over 120 that you need to seek emergency care. That might change. Some places say above 160. You really need to talk with your healthcare provider to get the right number for you. Really, really, if you see these things in your labs, you should be paying attention. Potassium below 3 or above 6. Sodium below 125. The EGFR below 30 or sudden drop. Creatinine that has doubled from your baseline, meaning it went from 0.6 to 1.2 or any doubling. Bad. All those means you need to go see a doctor right away. And sometimes you may even need to go see a doctor at like an urgent care or an ER. You may not be able to wait for your primary care visit. You can call your primary physician and they may recommend that you actually go to the ER. Alright, so the last section that we have is about the medication of herbs, supplements in your labs. When is it too much? Because of course a lot of people come to me and they say, I'm on this blood pressure medication, I want to get off of it. Or I often get these comments on my videos that say, hey, my friend is a diabetic, what other herb can they take? right? Now, of course, I work with clients to get them to where they're not taking all of the medications or reduce them or cut them in half and things of that nature. But my first thing that I say to people is don't get off your meds, right? Your body has been accustomed to taking the medication, and if you suddenly stop taking the medication, you're going to have other side effects. So, let's go back to our hydrochlorothiazide and the family of drugs associated with that, the diuretics. They work by increasing sodium and water excretion, right? So the labs that are monitored are your sodium, potassium, magnesium, your calcium, your uric acid, glucose, and the creatinine. The thing about these is that they may deplete your potassium level. You have too much potassium might become low. They may decrease your sodium and magnesium, and that's where you see that cramping that I talked about. They may lower your zinc, and if you know anything about blood pressure in the heart, zinc is also used to regulate blood pressure and improve heart health. And they could increase your calcium, which we saw that calcium buildup is bad for the heart, it's bad for the blood pressure. Now, I know the medication is supposed to be the cure, but sometimes it becomes a problem because each person reacts to medication differently. All of these things do not happen to every person who takes the medication. But in general, most of these studies that were conducted to get the medications approved were not conducted on black people as a whole, or they were not conducted on people who had multiple health concerns. And I know that for a fact in the medical community. Some of these drugs were tested on people who are relatively healthy in their 20s. They don't necessarily cover the 80-year-old. So that's just something to think about. The other thing is, when it comes to herb interactions, one of the herbs that a lot of people take is licorice root. Licorice root can worsen your potassium loss, right? Herbs that are strong diuretics can increase dehydration, which damages the kidneys. One of the natural ways to improve blood pressure is by supplementing with magnesium. As we saw, magnesium is in the sleep stack, right? And increasing your zinc. Decreased magnesium shows up as increased cramping. Dehydration increases kidney damage, which also increases blood pressure. Dandelion root is a potent diuretic that should not be taken with this class of medications, right? People say, they put me on a diuretic. Is there something natural for it? Yes, dandelion root is natural, and I have a dandelion tea. I also have dandelion capsules. Should you take those while you're on hydrochlorothiazide? No. Okay? That's one of the points I want to make with this presentation, is to make sure you don't just say, oh, I need this herb, and this is why I do herbal consultations before giving you herbal remedies. Okay? Licorice can raise the blood pressure, and it can counteract blood pressure therapy. Okay? So you don't want to take licorice root, which if you're on this medication. Next, we have lisinopril and friends. These are your ACE inhibitors. ACE inhibitors reduce formation of angiotensin II. Remember, angiotensin I is converted to angiotensin II by the enzyme, the ACE. Okay? Common lab monitoring for this, the potassium, creatinine, and EGFR. Doesn't really impact your nutrients too much. It's important to know with herbs, high potassium supplements and potassium-rich salt substitutes may increase the risk of hyperkalemia. Hyperkalemia means increased potassium. Increased potassium can lead to heart attack, stroke, death. Okay? Now, peppermint is a herb that is high in potassium and should not be taken while on these medications. Potassium that's found in peppermint also is bad for pregnant women. Therefore, when you see some of my herbal remedies, such as my traditional Uroflow kidney tea that has peppermint in it, I tell you that pregnant patients can't take it, right? I modified that recipe for people who are on ACE inhibitors so that they don't have the peppermint tea and they get all the other herbs and the benefits of the other herbs. Losartan in friends, the ARBs, similar, but it blocks the angiotensin II receptors, right? So potassium creatinine, the EGFR monitor, and again, the same potassium challenge that occurs is what you need to watch out for. Amlodipine and friends, these are your calcium channel blockers. They relax the vascular smooth muscle. Usually there's not a lot of monitoring from the lab standpoint outside of the fact your blood pressure is monitored, because the calcium channel blockers don't show up in the lab values the same way, because normally they don't impact your electrolytes the same way. There's no documentation currently about the nutrition considerations, but the important herb interactions are herbs that also lower blood pressure may have an additive effect. So it may lower your blood pressure too much. Your blood pressure bottom out, you pass out, you could hit your head. There's lots of things that can happen, but it can lead to death. Now, I put a caveat on this slide that herbs that lower blood pressure naturally include black cumin seed, blessed thistle, hawthorn berry, hibiscus, which is the number one. Every time I'm on TikTok, somebody's like, oh, I had high blood pressure and I started taking hibiscus and it cured it. Lily of the valley and garlic. Oh, so now people are going to add garlic and they're going to add hibiscus and they're already on blood pressure medication. They're going to end up in the hospital. Okay? Yes, hibiscus works very well. It does. But you have to understand why you have high blood pressure and what is occurring. Okay? If you don't change your diet, is hibiscus going to keep working? No. All right. We're almost done here. The next category, metoprolol and friends. These are the beta blockers. Reduces your heart rate, your cardiac output. So a lot of people, when they're on the beta blockers, they say, hey, I don't feel like doing anything, I'm tired, right? You have to monitor your glucose here, especially if you're diabetic, your heart rate, and sometimes the lipids. There's no real nutrient information, but again, herbs that slow your heart rate may increase bradycardia. Bradycardia is a condition where the heart beats fewer than 60 times per minute. You can measure your heart rates, your heartbeats, when you have your blood pressure cuff. It normally measures it for you. And it can be serious if the heart rate is slow, as it may not pump enough oxygen-rich blood to the body and the brain. People who have low heartbeat often have more brain fog, not remembering words, and sometimes this can be, somebody can say, oh, well, they're old, they might have Alzheimer's, or they might have dementia, or they might actually be on the wrong dose of a beta blocker. Okay? So common causes include aging, medications, infections, and sleep apnea. If you have sleep apnea, you can have bradycardia. Symptoms to look out for, especially as a patient advocate: fatigue, dizziness, chest pain. Okay? Sometimes a patient might have to go on a pacemaker. The information that I got about the bradycardia was found at mayoclinic.org. So, what do you do if you're on medication? First thing is, remember, don't stop taking them without your clinician telling you to stop. Don't let anyone, social media or otherwise, tell you just stop your medication. That's not the option. Now, once you're on, if you have high blood pressure, you can see me before you get on medication. But once you're on medication, these are tips for you to follow. 1, medication adherence. Take your medication at the same time every day. This is important. A lot of people take their medication willy-nilly or forgot about it. But these are chemical reactions taking place in your body. They require consistency. consistent dosing. Some people skip the medication and they go like 6 hours after they normally take it, and then they start feeling dizzy and things of that nature. They have all these other side effects. So you need to be consistent with taking your medication. If you take it first thing in the morning when you get up, then every day take it first thing in the morning when you get up. If the medication has to be taken with food, take it with your first meal or whatever meal. Take it the same time every day. Use a pill organizer or a phone alarm as a reminder. They make the pill organizers that are huge, have multiple sections and the days so that you can see that you can even put the time on some of them. Never skip a dose just because you feel okay. Just because you took your blood pressure that day and it was at 99. Don't skip a dose. Okay? Refill your prescriptions before you run out so that you're not in jeopardy of not having the medication. I've seen people do this, and not just for blood pressure medication. This goes for all your medication that you are taking. Hydration. Drink plenty of water, especially if you're on diuretics. This is even the case when you're drinking the Uroflow tea. Limit alcohol. Alcohol raises blood pressure a lot of times, and it can interact with your medication. Watch out for dehydration in hot weather or during exercise in the Florida heat where we're seeing 110 degrees weather. Do not go running. If you must exercise outdoors, exercise in the early morning hours or in the late evening when it's cooler. If you can exercise indoors, exercise indoor. If you're outdoors, carry plenty of water, wear a hat, make sure you have something cool, a fan or something, so that you don't get too hot. Too hot leads to dehydration, right? Bad for the kidneys, also bad if you pass out, also bad if you have a heat stroke, because heat strokes can occur. Okay. The other thing is diet considerations. When you're on these medications, you still have to watch your sodium intake. They say you could aim for the American Medical Association, the American Heart Association says you should aim for less than 2,300 milligrams of sodium per day. Most of the people who come to me are not monitoring their sodium on that level. I say don't add salt to your food. Most foods have some level of salt already, so there's no real need to add it. If you must add salt, don't use the Morton salt. Use Himalayan pink salt or Celtic salt. Use a different salt. Sea salt is a better alternative. Okay. If you're on ACE inhibitors or ARBs, do not overdo high potassium foods. That's your bananas, your oranges, your potatoes, without checking with your doctor. If you're on dialysis, your bananas, your oranges, your potatoes should not be consumed or consumed in low amounts. If you're on diuretics, you may need more potassium-rich foods. Right? So look out for that. They say to follow a heart-healthy diet. Now, you guys know I'm not a fan of the SAD diet, the standard American diet, because it keeps us sick instead of making us well. But I do like one thing that they suggest, which is more fruits, vegetables, whole grains, and lean proteins. I am vegan now, so I say no meats, but that's because cancer and a bunch of other things. So stay current with your labs. Keep all scheduled appointments. They're part of your treatment. Ask your care team what your results mean if you don't understand it. Stay tuned for all of my different educational videos so that you can understand as much as possible about your labs and how they are indicating your current state of health. Just a side note, when you go to the hospital, 80% of all diagnoses occur by laboratory results. So they are critical to your health care, right? And the everyday person has no clue what their labs mean. Okay. So here's some key takeaways. 1, high blood pressure is serious, but it can be managed. 2, your medication works when they are taken consistently and you have healthy habits. 3, lab work is not routine paperwork. It is a safety check and it has to be done. There's no exceptions. 4, know your key numbers: potassium, sodium, creatinine, BUN, EGFR, your glucose. Do not ignore warning signs like I told you, always being fatigued, cramping, all of those things. Do not ignore that. Big thing, you're not alone. Your doctor, your care team, your patient advocacy team, myself, everyone is here. I do interact with physicians on patients' behalf, so just know that that is possible as well. And the goal is not just to lower the numbers. This is the thing. It is to help you live a longer, healthier, and more vibrant life, right? So that's a whole practice, right? So, um, my final thing here is to invite you guys to connect with me. My website is www.fighealing.com, www.tsfcenter.com, drfryson.com, or email me at drfryson@fighealing.com. Thank you so much for watching. I'm wishing you love and health. Bye.